Okay, so this one is very interesting. It is about the psychotherapist. This is so in vogue right now. Therapists everywhere. Therapy, therapy, therapy. You have to have therapy. All right. And I think people are kind of going overboard with it. It's normal. It's always it's not linear, like people like to say. It was not really allowed or appreciated um, in in our parents' generation. Now in our generation, it's a boom, and it will go down again, but maybe not as low as what our parents experience. It will be somewhat in the middle balance. Okay, but today we're going to talk about the nice psychotherapist. Again, from Creative Aggression, The Art of Assertive Living. So in the first section of the book, he describes different nice personalities, different nice types, or let's say a nice type of people. For example, he would talk about the nice teacher, the nice parents, the nice mom, the nice children, the nice employer, for example. So now we're talking about, if you want to know about one of the other nice people, you let me know. I've already tackled the nice mother, the nice mommy, and the nice daddy. Now, this is the third one I'm talking about. I'm gonna talk about the nice psychotherapist. There is also the nice patients, the nice traveling companions, the nice port, the nice teacher, the nice students, etc., etc. So you let me know if there's any of these you particularly want to hear about. I want to tackle the nice psychotherapist because I think it's so important since it's in vogue right now, and many therapists, people see therapy as some kind of authority in so many aspects. So, and in a way that you just cannot question. It's not that they're not good, or it's not that that their work is not important. It is. I'm not undermining that. My problem is with the fact that oftentimes there is no room for questioning, for different perspectives, and also because therapy now has become a badge of honor. It's become a trophy. I'm going to therapy. You're not, you have a problem. I am going to therapy. I'm the bigger person and I'm better. And people use therapy to shame others often. And, you know, it's a whole subject. I can talk about that in another video. But I'm tackling this because I want to read this one because the idea people have of therapists is often wrong. What a therapist should be, what a therapist should look like, what the interaction should look like. I mean, the interaction between a therapist and a patient. Some people consider their therapist to be their friends, etc., etc. So, yeah. First, we're going to talk about, it's going to be a quick description, then the personality underneath, okay? And then the reward and the price. It will be like that for every nice person that the authors are describing. Always the I'm saying this in case you're seeing other, you're gonna see other. Oh my God, it's already 5 minutes. Okay, let me get to this. The nice, The nice psychotherapist is totally accepting, supportive, and loving with his patients. His therapy hours are fun and he makes people feel good. He will readily reduce his fee, not push bill collection, and run his hour over the usual 15-minute limit. The personality underneath. The, the nice psychotherapist is as dependent on his patients as they become on him. Basically, his niceness serves his needs, not his patients. For he is equally nice to all of them. He himself is uncomfortable with anger and aggressive feelings and prefers the loving approach. Beneath his niceness, however, there is considerable resentment and distance from people. His niceness is a head trip that protects him against feeling the anger that lies underneath. The reward. The nice psycho, psycho, psychotherapist is loved by his patients, builds a big practice, and has patients who stay with him a long time. He feels godlike and important to them. The price. The price. Because of his own needs, the nice psychotherapist tends to nurture his patients' dependencies and keeps them coming for years and years. To accommodate their therapist, the patients change little, if at all, though they always tell him how much they've changed. His own fear of anger and aggressive, assertive behavior sets a poor role model for his patients, who come to believe that they will someday be cured strictly by their doctor's lovingness. The psychotherapist's indirect aggression comes through he he duplicates the role of the overprotective mother by nurturing dependency and stifling assertive, aggressive behavior. Yes. So true. So freaking true. Because people, I mean, even I at some point, I say even I because I'm talking like that as if, I mean, as if I never thought like this. I did. Actually, I think I never really stopped and think about how a therapist should be. Um, but I do realize that sometimes people go to therapy for a very long time, and on the outside, when you look at them, when you observe them, not much has changed in their behavior. And I've heard many people talk about how they go to therapy, have they been going to therapy, they go to therapy. And I'm like, it's like it's an endless subscription. I want to talk about that in another video. It's like it's an endless subscription, and it's not really a work. It's not really something that they're actively working on. They pay for therapy, and to them the job is done. Like they attend, they go to these sessions, so they are, I guess they're better now. They're fixed, they're or whatever. So I'm concerned about how therapy, how people, what people really do, um, of this work, of these sessions with therapists. It's like you don't really know if there's much work being done, if there's any progress happening. And I've seen this image of the therapies that is so nice and so good and so everything so nurturing. I'm like, yeah. So to see this was something, to read this was kind of like something that really, I'm like, yes, that's what, it's like something that I've been feeling but couldn't put into words. And I also did not have the knowledge on these things to understand what was really happening. But to me, it was kind of off, you know what I mean? And, you know, your therapist is not your friend, and therapy is not always smooth. It's not always comfortable. It's not something that makes you happy necessarily. It's something that should stir things that are uncomfortable, bring back unwanted memories. It just, yeah. And sometimes you have to do the work, and the work is difficult. It's heavy. That's what takes time. Um, but yeah, I have to make another video about this because this is such an important matter, especially in these times that therapy has become such a big part of our society today, and there are many people selling their services not doing a good job, because it's kind of like a parent. You cannot, it's like your parent loves you, but it doesn't mean that that parent has to be lovey-dovey with you all the time. It doesn't mean that that parent has to accept everything that you do and be nice. I don't know if lovey-dovey is the right term, but you get what I'm saying. Like, always like, yeah, happy and not disciplining you and not, you know. So yeah, that was page 14 and the first edition of creating creative aggression. I think it's, I'm wondering if I should do another one. Yeah, I think that's it. I'm just realizing now, now that he has a chapter on the nice mother and the nice father. So I may dive deeper if you guys are interested.